Good evening, everyone. How are you all? I hope you can hear me well.
Yes, you can hear me.
Brilliant. So, welcome to First Aid AMC Clinical. I am Dr. Arshan Ahmed. For those of you who are here, I'm sure you want to know about AMC Clinical examination. You might be a beginner, might be in the middle of your preparation, or you might have just passed your AMC MCQ exam. Tonight, we're going to give you a very good idea about what's AMC Clinical, why people are failing this exam a lot, why the passing rate is even declining, even though there are a lot of researches, lots of courses, but still why the passing rate keep on declining every year. So we're going to go through each and every aspect of AMC Clinical preparation tonight. And I'm hopeful that you will have a better idea than before of why students fail this exam and what we can do to achieve a better success rate. So, first of all, let me explain about who we are and who I am, and then we will move on one by one. So, I am your main AMC Clinical course supervisor. And along with me, there will be several other tutors who will also be your course providers. There will be another clinical course supervisor who will meet you in our free 2-week sessions. And also there will be several other mentors who will learn in the free 2-week sessions starting from 7th of June. I am Dr. Arshan Ahmed. I am a working physician in Australia for the last 10 years. And I passed my exam, both AMC, MCQ, and clinical examination in my first attempt. And I passed my clinical exam in the first attempt with 14 by 14 station. And though that time also it was the face-to-face exam format. The exam center you guys are going for in your exam, I also did the same one. So I have full experience about how the face-to-face exam works, what an examiner really looks into a candidate, and how to achieve the highest possible mark in the exam. Now, my goal is not to make you pass all the 14 stations. My goal is to make you pass the examination. But if you dream big, you achieve at least something. If you dream only passing 9 or 10 stations, then you might not be able to achieve that. So I want to make sure that you dream bigger and then end up with at least passing the exam. So I can assure you that as a clinical supervisor, you are in the right hand. You are going to get all the important information that you need to pass this exam. I have worked in Australian health sectors in every possible aspects. I worked in hospital, I worked in GP setting, I worked as in many other different sectors where you might feel like not having the proper guidelines. So I know a lot of aspects of Australian health system, and with me, along with other doctors who are also working in Australia, we are going to guide you throughout this 5 months course to pass this exam in your first attempt. And that's my goal. Today is not just the beginning of one of the other course that we run. It's beginning of a journey that can completely change your future. It can change your career and it can change your family's life. So when I say your family's life, I take it very seriously. Teaching is my hobby. This is not my only work. I love my other part of the work, but teaching, guiding IMGs is one of the hobby that I have, and I love what I do. And that's why I want to make sure that when I say that the course that we are going to provide for you is going to change your career, your future, your family's life, I take it very seriously. We do not do a clinical course for a business. We take this course by heart. We make sure that each and every student who gave their faith in us, we are going to make sure that when you go to the exam, the examiner knows that this student is fully prepared and there is no way I can fail this candidate. So that is our goal in your batch. Every one of you who are here, you have already done a lot of challenges. You passed your exam, the MCQ exam. You definitely have to make a lot of sacrifice to come up to here, and there is no going back. I know it is quite difficult journey. It is not smooth, and everyone cannot go to the last part of the journey, and that is how it is. But I want you to know that it is not impossible. It is not as difficult as everyone says. The reason why candidates fail this exam is not because they are not intelligent, not because they don't have knowledge. They have, like most of the doctors who fail this exam, they might be a specialist in their country. They might be a pediatrician, obstetrician, maybe a cardiologist, but still they fail this exam just because it's not lack of knowledge, but they lack the structure, proper guidance. They lack the exam-oriented structure, and they lack consistency and proper time management. And that is why usually candidates fail. It's not about knowledge. Because when you pass MCQ, you have that knowledge. The problem is you don't know what an examiner expects from you. You don't know how to manage the time. That is something that we are going to focus on. I'm not going to teach you medicine because I'm sure you know enough. My goal and our team's goal will be to teach you how to think, how to communicate, and how to perform in the exam like an Australian doctor, not a doctor who is practicing in Southeast Asian countries or any other overseas countries, but as a doctor who will be performing in Australia. That is what we are going to show you. After the course, my goal is not to just make you pass this exam, but to make sure that when you start being a doctor in Australia, you can work as a safe doctor and you can work like a doctor who people will come and see, who people will not think that this doctor just passed the exam but doesn't know how Australian system works. That's not what other colleagues will think of you. That I'm going to make sure of. Over the course, which is 5 month course, there are going to be days when you will feel overwhelmed, you will feel exhausted, you will feel disoriented. And that is the part of the journey. No one can say that when I started AMC clinical preparation, I knew everything. No one can say that I knew how to manage the 8-minute time in my first day of role play. I still remember the day when I did role play with some of my friends. So we had a group of four people, me, two doctors from Pakistan, one doctor from India, one doctor from Bangladesh. So this was a group of 4 or 5 doctors. I remember the first day when we did the role play, we were a mess. We did not know what we were doing. We were just doing things, and even we did not know how to talk. The accent was terrible, definitely. So, but we passed. All of us passed eventually in the exam. And that is just because we made sure that we practice the cages that is frequently coming in exam over and over. We made sure that it is the consistency, it is the practice which made us more and more confident every day. So I want you to know that this is not something that you are going to achieve in a single day or a single month. It is something that will happen over months and months of practice. And every student who is going to be with us, we are going to make sure that you do not feel that there is no connection between mentors and the students. We are changing the course structure this time. The course structure is going to evolve in a way that becomes more candidate interactive perspective, which means that there will be more interaction between mentors and the students who are going to be under our umbrella. And we want to make sure that you feel that there is someone standing behind your preparation and someone pushing you to go forward. And that's what we are going to achieve in your course. So far, throughout the last 7-8 years, when we did the clinical course, our focus was mainly to deliver the knowledge, deliver the important things. That was our main focus. But time to time, especially over the last few years, we found that after a few months, a student disengage. They can't keep up. There is the time when a student needs a bit of push. And we're going to make sure that you get that push from us to go forward, not going behind or standing in a plateau. So that is what we are preparing this time. We are going to discuss about all of this, that what's my plan about this new course, and I'm sure that you'll love it. I want you to trust what we are doing. I want you to practice seriously, ask questions, make mistakes. Because if you make mistakes here, you will not make that same mistake in your exam. So that's what we will look for, that make mistakes, so that we can show you that what is the right approach. And do not feel shy in front of the others to talk or to do a role play. Because if you can do role play in front of 50 to 100 people, then you can do it in front of one person in the exam. Okay? So AMC clinical exam is not impossible. It's not something that cannot be achieved. If you are oriented with our first aid group, you will see that every month there are lots of students who are passing the exam. We tend to not to share those success stories in the Facebook group a lot these days, but we see every month a huge amount of students from first aid pass the exam in their first attempt. A lot. So we want to make sure that when you go to the exam hall, and this is going to how your exam hall is looking like in Melbourne, you will be one of that candidate who has the confidence to pass this exam in the first attempt. Okay? So tonight we are going to dissect AMC clinical preparation and also what to do when you start preparing for it, what to avoid when you prepare for it, and how first aid is going to help you to achieve the success in clinical exam. This is an interactive session, so you will be allowed to ask questions at any time. So if you want to ask questions, please either just raise your hand. I can always see if someone raised the hand on the Zoom meeting, then I will allow you to unmute, or you can always write it on the chat box and I will answer that anyway. And at the end of the class, you can always unmute yourself and ask any question that you have. All right. Tonight's class is divided into one, we're going to dissect each and every step of AMC clinical exam, and also how first aid new course is changing or reshaping the clinical preparation. We have changed the course structure fully in your course, and in that structures, our main focus is going to make sure that we can reach each and every students to make sure they can go on to keep their preparation smoothly and nicely until they go for the exam. Let's start then. So first aid AMC clinical course is going to start from 7th of June. So we still have got 2 more weeks before we start our full course. As you might already know that this is a 5 months course, and we always allow 2 weeks free session so that you can learn about our mentors, you can learn about our approach, how we take the sessions, what is going to happen in your course. So you will have a very good interaction with us before you start preparing with us. So that 2 weeks free session will be a very, very important class for you. If you haven't seen the schedule yet, it is already given in our First Aid AMC Clinical Facebook group. So I'll also share that at the end of the class. From 7th of June, for the next 2 weeks, there will be psychiatry classes, there will be cardiology classes, and there will be few role play sessions. Please join those sessions because you will learn about AMC clinical preparation in a much broader, much comprehensive way. And that's going to help you even to start your exam preparation if you're a beginner. The course details, I'm sure all of you have seen these pictures all over the Facebook, but we will discuss each and every part of it today. Also, and remember that First Aid AMC Clinical is a registered CPD provider in Australia. So we are one of the registered organizations who can provide CPD certificate under Australian Medical Association. So we achieved that kind of standard throughout the years of experience so that our course is able to give you that kind of benefit, that kind of course structures and interaction so that you can achieve a CPD certificate from us. And the course has 130 CPD hours, which is more than enough for 1 year CPD requirement for Australia. I know you have a lot of questions about CPD. We will discuss that at the end because it's not more important than passing the exam. Our main focus is to make sure you pass the exam. Now, let's talk about what is the difference between first aid and other courses. In first aid, you get extensive notes for each topic. There are many courses where you will not get any notes. You will need to write down what a mentor is teaching. And sometimes we find a lot of feedback from students who has done this kind of courses where they can't actually give full attention to that class because they need to write notes as well. One, that they have to write notes during the class. Second, that they don't get access to the class recording. After a few weeks, the class recordings will no longer be there. So what happens in those kind of courses that when you start preparing for something like, let's say you are preparing for medicine, and let's say you are listening to the recorded session. One, that you have to finish the recorded session. So once you start, then you might have 2 or 3 days to finish that particular video because after 2 to 3 days, the video will be deleted. So you will be in a hurry. Someone might be sick, you might need to attend something, you might have a 1 week gap in your preparation, and you will be just losing the access. So when we talk about AMC clinical preparation, the AMC clinical preparation is not a one-day preparation. It's a preparation which takes time. It takes a lot of effort to prepare for clinical. And there is a lot of things. If you need to make a note for 500 cages, normally we say there are at least 300 to 500 cages that you need to prepare for. And if you need to write 500 cages notes, that itself gonna take 3 to 4 months. And at the end of the day, you will have so many papers in your preparation, you will not be able to find out where is the note of medicine GIT, where was the note of headache cluster, where was the note of shortness of breath cluster. You will be in a mess. And that is not what we ask you to do, because you really don't need to do it. The first aid AMC Clinical has everything in place, has every notes for every possible cases that can come in exam. And the cases are not taken from some other people, taken from some other course. The note that we prepare for you, it is all written by our mentors with their own hands, with their own research, with all the new Australian guidelines. If you have no, if I don't know if any of you have done our clinical course in the last 1 year, if you have, then you would know that in the last 1 year, the course note has got fully changed. We have changed everything. There is no past notes there because there has been a lot of changes in the guidelines. The examiners has changed their way of marking the candidates. The examiner has now evolved, and we had to evolve to keep up the pace as well. So in the last 1 year, first aid AMC note has been fully changed. We have vanished the last 3-4 years notes, and the notes that we are giving you right now, that note is fully reshaped. It has been changed. It has been adopted according to the Australian guidelines. And if you do the course, you will definitely find that out. That I can assure you. You do not need to rely on anything else except the notes that we will give you in the course. You don't need to write anything. You don't need to even research a single thing during the course preparation because we do the research for you. We make the notes for you. If you are someone who feels that if I write things, I can memorize easier, that's fine. You can always write small little things from the note so that you can remember it. But think about some courses where everything you need to write down during the class. So maybe the first time you hear the recording or you do the class, you just focus on writing the notes. That takes, let's say, 6 hours for a topic. And then second time you need to again hear the recording just to even know what was said in that class. Because first 6 hours you focused on writing the notes only. You did not focus on what the mentor was saying. So that is the problem with not having a proper note in your hand in your clinical preparation. You need notes. You need a proper guideline in front of you, which you can read anytime you want. And that access matters a lot because the night before your exam, you will feel that need. You will feel that if I had access to some written notes, which I could just revise as soon as possible, as fast as I could, that would really make a lot of difference. And that's why First Aid AMC is very unique, very different from any courses in Australia. We have everything in here. We do not ask you to pay for each topic differently. We do not say that pay us $500 for medicine, GIT, and neurology. We do not ask you to pay us $500 for gynae obstetrics. We do not ask you to pay $300 for psychiatry. We do not ask you to pay us differently and ended up paying more than $3,000 to $4,000 to finish your AMC clinical preparation. Because there are courses who will do that where they might divide the courses in a way that for each, even like for medicine topics, you might pay more than our whole course just to finish the medicine topic. And that's what we don't want you to pay, because when we were an IMG like you, we were also struggling because AMC clinical fee itself is quite a lot. With that, when you need to pay $4,000 for exam preparation, and they don't even give you the recordings for the whole time of your preparation, no notes, and then ended up paying for each topic differently, that becomes a huge load for you. Remember one thing, that there is always a chance that you might not be able to pass the exam in your first attempt. And that is hard truth, because still there is only 20 to 30% passing rate in clinical exam. So 70% people will need to go for second attempt. I know it is not very reassuring. I know it's not very, it doesn't look good, but that is the hard truth. So why it is important to have a recordings, have a class notes in your hand is that if in case you fail the exam, you will still have some resources to work on because you might be able to pass your exam within 3 more months of preparation. But if you don't have anything, you again pay for that same course just to get that recording, just to get that note once again. And that's what we don't ask from you. We have everything, all the topics that you need to pass this exam, saying medicine, surgery, pets, obstetrics, everything in the course, and you enroll into the course and we finish everything under that single course. We do not divide the course into multiple million topics and ask you separate payment one by one. Because yes, we could make a huge profit by doing that, but we don't do business with our own people. Because I know how you are giving us that payment because it is either from your parents' pocket or from sacrificing a lot of things to even save up that amount of money to prepare for exam. So we value that effort. I know that most of you do that. So we value that effort. And we will make sure that once you join the course can provide you everything in an affordable, cost-effective way so that you can prepare and pass the exam in your first attempt. The course has extended recordings with no restricted hours to watch a video. As I said that there are courses where you will get very limited recordings with restricted hours to finish a video. Like you get 48 hours to finish a particular topic, which can be really difficult for a lot of students who is working in Australia or who is working in their own country. Because you don't have that much time to finish a topic, making a note, and then write down everything. Because 48 hours is not enough. It simply is not enough for preparing a particular cluster. So we don't do that with our students. You get enrolled into the course. The 5 months course, you get extended recordings throughout the course. And also you can opt for extra 5 to 10 months of video access. So almost every one of you will go for exam within 1 year. So we give you access throughout that time. You can go for 10 months access. If you want, you can even go for 15 months access. And with that access, you will be well prepared for your exam and you will be able to go for the exam with everything in your hand. You don't need to wait or you don't need to look for so many notes everywhere scattering. Remember one thing, that the most affordable or most popular fee for our first aid AMC clinical is 999 Australian dollar. There will be courses where you will be paying, let's say that for medicine, there are maybe 2 or 3 topics. For that, you will be paying $300. Then there are 3 more topics, again, another $300. For gynae obstetrics, maybe $350 to $400. Pediatrics, another 300, 400. Psychiatry, let's say 300. Physical examination, 400. So you count. You'll be finding out, this is just an assumption, but that's what happens. With all of this, you will be paying thousands and thousands of dollars to finish your AMC clinical preparation, not even a single note from the course. And that's not what we will do with you. Not only that, you get a lot of role play with us throughout the course so that we can give you that exam-oriented approach and give you the proper feedback to start your preparation. . You can have a look here that this is just a glimpse of our students who has passed recently in the exam. So every month there are so many doctors who pass AMC clinical. So when you look at this picture, you should feel that it's not difficult. It's not something that you cannot achieve. All right. I hope I could give you some hope to start your preparation in AMC clinical exam. We will not brag about the course a lot anymore. Let us go ahead with the second part of today's discussion, which is going to be how to start your preparation and what AMC clinical examination is, how they mark you, what are the main focus you should be on. That's what we're going to do now. Okay? So let's start. AMC clinical examination is an in-person exam. So you need to go to an exam center to appear this exam. There are online versions, but that's very limited, and most of you will not be able to achieve that. So you'll be preparing for face-to-face exam format. And our focus in the course is exactly the face-to-face exam format. As you might have seen the first picture that I have shown you, this is the exam center in Melbourne, NTC. In the center, you can see that that's how an exam room will look like. In front of the room, there is a monitor. And if you look at this picture, that makes a lot of idea of how you'll be in the exam. So when you go to the exam hall, you will be taken to the waiting room by some marshals, and then you will be able to keep your belongings in a locker. And after that, they will give you a briefing about how the exam is going to be. They will also give you a card. So see that every student will have a card hanging down at their neck. That card will have the station number, the station that you will start your case with. So some of you might start with case 1, some of you might be starting with case 2, maybe someone will start with case 16, and you will be just rotating around. Each station will be exactly like this. So you will be standing in front of the room like this, and first bell will run. The first bell is about starting your 2-minute time to read the case on the monitor. So on the monitor, you will be able to read the case, and you get 2 minutes outside the room to read the case, read the task, and think what you're going to do about this case. And then after 2 minutes, another bell rung. Then you are supposed to go inside the room. When you are going inside the room, the examiner will stand in front of the room and they will greet you. You should also greet the examiner. Hello, examiner. Examiner will ask you to show you the ID. You will be showing your ID, and examiner will confirm that you are the right candidate for this station. Examiner will then introduce you to the role player inside, and then your exam will continue. Now, this initial introduction with the examiner is part of your exam. The timing will not stop. So you get 2 minutes outside to read the case and 8 minutes inside to finish your case. Your 8 minutes is continuing. So the time you are talking to the examiner, that time is also part of your exam, 8 minutes. So normally you never get full 8 minutes to do a case. So your maximum you will get 7 minutes 45 seconds. So 15 seconds will be lost with this introduction. So when you prepare for the exam, our recommendation is that you prepare with 7 minutes 30 seconds in your hand. The 15 seconds will be bonus. All right? Once your 8 minutes is up in the exam, another bell will run, and immediately you need to leave the room. Doesn't matter whether you could finish your task or not, you cannot keep on talking after that bell. You go out and you rotate, you go to the next task. In that way, you will be rotating your 16 stations. After every 4 stations, there will be a resting station. See that some of the students are sitting, they are in the resting station. So resting station means that 10-minute rest. So you will not be doing any case in that 10 minute. So after 4 station, you get a resting station like this. So basically, you will be rotating in 20 stations or 20 rooms. Out of 20 stations, there are 4 rest stations where there is no cages. So you get 16 stations, and in 16 stations, you have 16 cages. Out of 16 stations, 14 cages are scored and 2 cages are pilot. So again, just like your AMC MCQ, you do not know which one is pilot and which one is scored. So each case is equally important to you. Out of 14 scored station, if you pass 9 out of 14, you pass this AMC clinical exam. And our goal is to make sure that you pass this, at least 9 out of 14. If you can pass this, we are very, very happy. We don't want you to pass 14 station. And that's not what you also need to do. We need you to pass at least 9 station and be done with this forever. All right. So clinical examination structure. You already know that there are 16 assist station, 4 resting station. Stations are 10 minutes duration, 2 minutes of reading time, 8 minutes of assessment time. In an exam room or in each station, there will be an examiner, there will be a role player. Role player are simulated patients. They might be real patients sometimes. We have seen recently, especially in May exam, there has been a lot of real patients. Patients who have symptoms, patients who have clinical examination findings such as hepatomegaly. Someone might have lots of cherry angioma. Someone might have the chronic liver disease signs in them. So someone might have gynecomastia. So you get those kind of real patients in the exam these days. So most of them are simulated patients or made up patients, but they will talk like a real patient. And you should also think that they're real patient in front of you, so that you don't think that, well, someone is crying in front of you. You know that she's just doing it for exam. You will not show her the empathy. So do not think like that. Even though we know that most of these are made up stations, but these are supposed to be real patients in front of you. And you talk to them exactly like a real person and real patient. And you show empathy, you show everything you would do if a patient was crying in front of you. Your assessment criteria. If you have a look here, that the AMC clinical examination, the case distribution is like this. So you get 5 to 6 cases from medicine and surgery, pediatrics 2 to 3 cases, gynae ops 2 cases usually, psychiatry 2 to 3 cases, physical examination 3 to 4 cases. We see that most of the cases, most of the exam will have 4 to even 5 physical examinations sometimes. We have seen 5 even in some exams. So the cages distribution can change. There is no hard way of saying that this is exactly how it's going to be, but this is a outline of how it might look like. So medicine carries the highest number of cages, followed by physical examination, and then this pediatrics, gynae, and psychiatry, they usually tends to change a lot. Assessment criteria, so you will be assessed on different presentations of medical, surgical, pediatrics, gynae ops, and mental health. Remember, these assessment covers both general practice setting, so community setting, and also hospital setting. So your patient might come to in a clinic setting, which is general practice setting, or in the emergency department of a hospital. So when you read a question, it's very important to know that where exactly you are, because based on your position, the management of that case might differ. Because you can't manage everything in a GP setting. GP setting is primary care, which means non-emergency care. If something is emergency, you need to send that patient to an emergency department. So knowing where you are working in that particular station is really important, especially if management is a task. So each station can focus on one of these four predominant assessment areas. So tonight we are going to dissect the clinical examination step by step. You will know how examiner thinks when they are marking you, what kind of a score they are giving you. So each and everything we will be showing you tonight. So history taking, physical examination, diagnosis, sometimes differential diagnosis, management, and counseling. These are the main predominant assessment. Let's talk about question structure and different tasks you can get in your exam. When you read a case in the exam, the first thing you need to know is this is a case of physical examination station or if this is a full station. Full station means that you need to take history, you might need to ask physical examination from examiner. So there can be a huge amount of task in a full station. Whereas physical examination station are like this, like a middle-aged patient coming to the emergency department with sudden onset of spinning sensation and unsteady gait. Also having disturbed sensation in her ear. So this is a kind of a vertigo case. Very important for exam. Perform relevant physical examination on the patient. So they sometimes even write down the time that you will have to do that case. And usually if the time is written on the exam question, it means that at that minute, after 7 minutes, you will get a bell. So if any time on the question time is written, then you will also get a bell after that particular time. Okay? So 7 minutes you get a bell. That means you will have 1 minute to give the diagnosis and differential. This is called physical examination station, where you don't need to take a history. You need to perform the physical examination on a person and you need to find out the findings by doing the examination and then give the diagnosis and differential to the examiner. That means in this particular case, which is the physical examination station, let's say someone coming to you with vertigo. So you will need to do all the vertigo related examination on that patient, right? So you'll be trying to find out whether this patient has got peripheral causes of vertigo or central causes of vertigo. So you will include all those physical examinations, like you will be doing the Hall-Pike's maneuver for BPPV. You'll be doing the examination for Hind's exam, which is for finding out whether it is a peripheral or central vertigo. So all of those examination you'll be doing on that person to find out the findings. Okay, that's what we call physical examination station. The other station is history taking physical examination or full station. The full station also has a physical examination as well. But the difference between this one and this one is this physical examination from examiner, you need to ask the examiner the findings. An examiner will give you the findings when you ask it. You do not need to perform on a patient. So, like this case, which is a full station, a 30-year-old female comes with sudden onset of shortness of breath since last night. So our presenting complaint is shortness of breath. Your task is history from the patient. physical examination from examiner, ask investigation from examiner and explain the investigation to the examiner, give diagnosis and differential to the patient, explain further management to the patient. Now, these are the number of tasks that you can have in a particular case. You do not get 5 tasks in the exam. Sometimes the case will be take history from the patient, physical examination from examiner, give your diagnosis and differential. Most of the time it is 3 to 4 tasks in the exam. So this is what we call full station. How to manage the time? So managing the time is something that's the most important aspect of your exam preparation, because you don't get to bring your watch in the exam, and there will be no watch or clock in the exam room also. So you'll not be able to know how much time you have consumed already, how much time you have left. You don't have any idea. I do not know why the exam do that, because in real life you can have your watch and you can always look at your watch, but in exam you don't get that. So you need to meditate the time. Somehow you are supposed to know the time to pass this exam. And I don't know why they do that. There is no one who knows that. It's been happening forever, but could be that this is one of the ways that they can fail you in the exam easily. Because if you would know the time, most of you will be able to finish the exam, and they had to pass more students, which they don't want. Whatever it is, we need to follow what the exam rule is. So basically, this understanding of the time comes from a lot of preparation, lot of role plays, lot of practice. So with practice, you know how much time you might have for this case. Every one of us who passed the exam, somehow we know. I don't know how I knew that my 8 minutes is done, but I always knew that I have taken enough time and my time is almost near. And I'm sure everyone who passed the exam, they got that idea with a lot of practice, and you will also achieve that. So please do not feel overwhelmed about it. So first of all, you got in the outside, you get 2 minutes. In the 2 minute, which is the most important 2 minute for that particular station, because you get to read the question. So when you read the question, you should know that what is the age of the patient. So find out the key point from the stem. So, and also quickly look at how many tasks you have got. So quickly, what I will do in the 2 minute, I'll quickly read 30-year-old female presents to the emergency department, sudden onset shortness of breath since last night. So this is an acute shortness of breath cluster. I am in the emergency department. This is a young female. What are my tasks? History, diagnosis, and differential. So it took 15 seconds to know what this case is all about. So it has to be a quick reading and picking up the important things from that case. Some cases might be a bit larger, not just a single line. In that case, it can take 30 seconds to even read the full case, but that is fine. So the key points in a particular case is something that you should pick up immediately when you're reading. So you have read the question, you know how many tasks you have got. In your mind, you already know that you have got only 2 tasks. So you need to take a good amount of history in this patient, because your task is taking a history and diagnosis differential. If that is the case, which is not a lot these days the task amount is usually 3 to 4. So you get a lot of time to do this. So you have 8 minutes. So you can have 6 minutes to do your history and 2 minutes to give the diagnosis and differential, minus that 15 seconds that you are losing when you're talking to the examiner. So when you have 2 tasks, your history will be very detailed, very comprehensive. Each and everything should be asked in that case. So in that 2-minute time, you think about, you will do the brainstorming. The brainstorming starts with, this is a case where my main focus will be history taking, because that's the key step here. Because without a proper history, I cannot come to the diagnosis. So that's my key step. So brainstorming means immediately you still have got at least 1 minute 30 seconds to think of as many differential diagnoses as you can. So for acute shortness of breath, you'll think of all the possible differential diagnoses this patient needs to rule out. So for acute shortness of breath in a 30-year-old, what you will rule out? Anyone? You want to unmute yourself and let's see where you are staying at the moment. Anyone unmute and tell me that what are the most important differential for acute shortness of breath in this patient?
It can be asthma.
It could
So you think about asthma, okay. What else?
be pneumonia.
Very good. Pneumonia, yeah. Anything? Yes, so you have got, very good, we have got pneumothorax, yep. What else? We have got AMI.
It could be pulmonary embolism.
That's really important, yes. Pulmonary embolism. So you've got pneumonia, pneumothorax, pulmonary embolism. Respiratory causes are almost done. You can still bring pleural effusion. Then cardiac causes, MI. What else? Acute shortness of breath. All these 30-year-old, in cardiac cause, is there anything else that you want to rule out?
Pulmonary edema.
Yes, very important. Left heart failure. So left ventricular failure with pulmonary edema, important. Anything else that can present in a 30-year-old having palpitation with shortness of breath?
Anxiety.
Yeah, like especially you can think of anxiety is definitely important. Panic attack can come with shortness of breath. We can also think of arrhythmia. Any arrhythmia can come as shortness of breath with palpitation. SVT, AF, they also come with shortness of breath time to time. So these are our main important things that I would definitely rule out. There are a few other things like you want to rule out anemia in this patient, 30-year-old. If she is a vegetarian, maybe she is losing a lot of blood in her period. She might be also having anemia, and that might cause shortness of breath as well. Very important is psychiatric causes in this kind of young female patient. So see that you are already thinking in your head. So your history, the brainstorming in that 2-minute time is to find out what are my differential diagnoses for this particular case. And if you can think of as many differential as you can remember, you can easily pass the history. Because it's all about differential diagnosis in the exam. We see a lot of candidates, the reason they fail the exam is just because they don't ask as many differential as they can. They might just ask few questions and then they forget the whole differential and they focus on smoking history, alcohol history, past medical history. That's not the main history. Your format of history should be in a way that it has a proper structure. So in our course, when you will start doing that 2 weeks free session, you will understand about the structure, that how a history structure should be, how a physical examination structure should be, how a management structure should be. So each and every part of the task, we will give you a structure and format that you can follow and you can easily achieve pass mark in that particular case without losing a lot of time by asking unnecessary, irrelevant questions. Okay? For someone who said asthma, asthma present with chronic shortness of breath. But if it is an asthma flare-up, that can present with acute shortness of breath. If it is a COPD exacerbation, 30-year-old having a COPD is unusual, right? But still, that is also one of the differential for shortness of breath if patient comes with acute exacerbation of COPD. So this is your understanding that how you manage that 2-minute time can give you a lot of benefit when you are asking questions, because in your mind you already know what questions you are going to ask. Okay, so when you read a question in that 2-minute time, please make sure that you do not take a lot of time to read the question and read the task. You should always remember the task. Every exam, the station will have different tasks. So please make sure you know the task. Sometimes we see that candidate, they don't care about the task. They take history and they don't even look at the task. They go to the physical examination, then they go to the diagnosis, then even they talk about management. If you say too much, that's not going to give you extra mark. That will fail you in the exam because it means that you are not reading your task and you don't know what you're doing. So know your task by heart. Know what they're asking and focus on that only. This is another task. The same question can come with 3 tasks and your timing will be different in that case. You can't use 6 minutes for history anymore. So you will need to cut short your history because now there are 3 tasks. Number 1, so patient is still the same patient, shortness of breath, history from the patient, physical examination from examiner, diagnosis and differential. Now you don't have 6 minutes anymore. Now you cut short the history. So how we will manage the time in here? Maximum 4 minutes for the history, 2 minutes for physical examination from examiner, 2 minutes for diagnosis and differential. Now there is always a chance that you can play around. Let's say that you could not finish history in 4 minutes. It took, let's say, 4.5 minutes. So you took 30 seconds more. Then you need to cut short that 30 seconds from your physical examination. Means that you need to ask the physical examination a bit quicker. We don't recommend that because you really need at least 2 minutes for each task, especially physical examination and diagnosis and differential. But if you're running out of time, or you know in your mind that I have already lost a bit more time than I should, then you need to be quick in your next task so that you can at least manage to finish everything in your 8 minutes. Okay, so history from the patient. Now, when you know that it is 4 minutes, then you don't ask a lot of history. That means irrelevant history will no longer come into your differential. Like what are irrelevant in an acute shortness of breath case? Like uncommon. Irrelevant could be, let's say that depending on how the patient presents, COPD in a 30-year-old is very unlikely. So it's not our main differential diagnosis. Even pulmonary edema is very unlikely in a 30-year-old. So even if you don't ask LVF questions here, they will not fail you. Okay, but if you don't ask the myocardial infarction question, if you don't ask pulmonary embolism question, pneumothorax, pneumonia question, they will fail you. Because those are very, very important to rule out. If you don't ask psychiatric question, especially to rule out panic attack or anxiety attack, they will fail you. So you need to know for each case which is really important not to miss. These are what we call key steps. Every station has got 3 to 4 key steps. And when you read a case, in your mind, you should have an idea that for this particular case, I should not miss this differential diagnosis at all. Like if you miss anemia differential in here, they will not fail you because that's not most important for an acute shortness of breath. Okay? So ruling out more emergency, more important life-threatening conditions are really important key steps. And losing those key steps means that the likely chance of passing the station will be very low. We'll talk about these key steps, predominant assessment area just in few minutes. Look on this question, same question but has 4 tasks. So 30-year-old female, sudden onset shortness of breath, history, physical examination from examiner, give your diagnosis and differential, explain management. Now, you don't even have 4 minutes for history here. So you divide the history as 3 to 3.5 minutes. Physical examination will be very quick in here, 1 to 1.5. Diagnosis quick, 1 minute. And management, you need minimum 2 minutes. So when you have a four task, examiner knows that you will not be able to touch everything. And they don't also want that from you. The history will be very focused, short history taking. So you'll mainly focus on making sure patient is vitally stable because it's an acute shortness of breath case. You will make sure that you ask the shortness of breath question. And then what are the most important differential? Rule that out. So pulmonary embolism, pneumonia, pneumothorax. That's the respiratory cause. It will take few questions to rule that out. MI and arrhythmia. And then anxiety. These are your most important differentials. And then lastly, you will ask about SADMA. So we'll talk about that later on. So smoking, alcohol, past medical history, and if you have time, family history. But basically, that's your 3-minute history. Short, but focused. Okay? So knowing your task and managing the time according to the number of the task is the most important thing in the exam. Because when we discuss a case, we discuss each and everything about that particular case. We discuss history in a broad, comprehensive way. But time to time in exam, you will not get that time to ask each and every question. Because when we prepare you, we make sure that if the history is 6-minute task, you will be able to do that. So if you think that, no, I have to finish each and everything about shortness of breath, doesn't matter how much time I am having, because I really want to do best in the history taking. That's not going to pass the exam. That's not going to help you to pass. So managing the time is an integral part of passing each station. If you can't finish your task, they can't pass you because you have to get those marks. So please make sure you know that what are the tasks, how many tasks you have, and how to manage your time in the exam. Let's talk about how AMC mark a candidate. This will give you a little bit of a better idea of why managing the task is important and what is a focused history taking means and what is a detailed history taking means and where to do what when we do focused and when we do a detailed history. So basically detailed history is when you have only 2 tasks. So you have 6 minutes for the history, and focused is when you have 3 to 4 tasks. So in that case, your history will be shorter because it is the history where most of you lose most of the time. So AMC mark a candidate in a global rating for each station. This global rating is an overall score for a particular station. It is based on key states, the relevant assessment domains for each station. We'll talk about the domains. So domains are your task. History taking is a domain of a particular case. Diagnosis. In physical examination, the domain will be accuracy of your physical examination, your technique of examination, management and counseling. So the domain means that in this particular case, let's say this one, your domain of assessment will be first approach to the patient. So every case you get marked for your approach. That's why approach is super important. It's an invisible killer. I say it's a silent killer in the exam. You don't know that you are getting marked for it. There is no task, but it is there. And many candidates fail just because of their approach. Approach is something that you need to learn. In the course, we are going to give you some particular way of starting a conversation with a patient, and we will give you specific phrases, specific response to particular answer from a candidate. So when role player says that I don't feel safe at my home anymore, and your next response is how long this is happening, or you just ask some random question that, so what are you planning right now? So a person just told you that I don't feel safe at my home anymore. Your response was, what are you planning to do? Do you see where the problem is? The problem is you did not recognize the issue. You did not give any kind of empathy to that person who just shared something so sensitive, so personal with you, and you did not give a shit about it because all you want is to pass this case. That is the problem. So a proper candidate who is going to pass this case, they will at least say that I'm so sorry to hear that, Jenny. I want you to know that I'm here with you. No one should feel unsafe at home. And I'm going to make sure that you do not feel like this. So you have to say something in response to this. I've got 3 miscarriages, doctor. And your next response was, are you planning again? That's the problem, guys. So problem is not exam. The problem is your response. How you respond to someone's sensitive answer, that's what fail you in the exam. Because you do not know, because you always, in your mind, you are nervous. You think that this patient is not a real person, so I don't give a shit about this patient. I want to pass this exam. I want to finish everything in 8 minutes so that I can pass. That's what you're thinking in your head. But that's not what's going to pass this exam. That's not what's going to help you to achieve a pass mark in this station. Because you are getting tested. Each and every response you are doing, each and every response to a person, to the role player you are giving, that's what's approach all about. So in approach, most of the candidate, especially first-time candidate, will fail just because they are not giving a proper response to particular things. And those are the traps, because the role players are given their instructions that say this to the candidate. And those are always there. In every stations, there will be some traps. And if you are falling in that trap, there is no way you will pass that. You did everything. You finished the task in 8 minutes. You did really super with your history physical exam. Still, you don't know why you failed. You keep on thinking that I did everything the other candidate who passed did. And we see a lot of question like that. Doctor, I've seen exam feedback, someone who said each and everything I said, but I got only 3, but that candidate got 7. I just don't know. I will go for an appeal for this station. That is the problem. You don't know that most likely you did not make it because of your approach. So if my patient says that I got 3 miscarriages, doctor, I will not say anything but sorry. I will say, I'm so sorry to hear that, Jenny. It must be so devastating for you. I want you to know, Jenny, that I'll do my best to find out what's causing this and help you. I want you to know that I'm here to help. I'll do everything possible to make sure that we can manage this. We can find out the cause and make sure that you can have a normal, healthy baby and a pregnancy. So you don't need to say a lot. At least say, I'm so sorry to hear that, Jenny. It must be very difficult for you. See how I am changing my way of talking, the change of my voice, change of my tone. That shows that I'm really empathic for my patient. I'm sorry to hear that. I don't need to cry in front of my patient to say I'm sorry. And please do not do that, because some candidates, they become overwhelmed. They become like really empathic. There is a difference between sympathy and empathy. We don't want you to become a friend or sympathetic to the patient. We want you to become empathic to a person. Think about it is a person in front of you who has endured 3 back-to-back miscarriages. She is now in her 35. She's planning a pregnancy, having a healthy baby, and that's all that she's dreaming of. That's what you think. And when you think like that, you will know that how to change your voice, how to talk to that person. Because you can't just say that, no, you know how to say. That's another problem. Like some of my candidates or our candidates, we see that because we told them to say sorry, they say sorry. So I have got 4 miscarriages, doctor. They say that, Jenny, I'm sorry to hear that. I'm sure I'm going to help you in this regard. See that they did not show anything because they know that they have to say sorry. They just said it. They did not mean it. So it's not about just saying things, because examiners are very well oriented with the candidate's behavior, that they understand that if this candidate just memorized or did a course and they have given this kind of information that you have to say sorry here, and they're just saying it. That is our next level problem. One candidate doesn't even say anything. That's definitely a fail. The second candidate, they retained a little bit that, yes, if I find something unusual, if I see that the role player is sad, I will say sorry. But they're not meaning it. That next level is most of our problem, because you might know that this kind of approach, but you are not meaning that in the exam. You have to show it that, yes, I am sorry to hear that. I can't imagine how you feel right now. I would not know, or I would not understand what I will do if I was in your position. But I want you to know, Jenny, that you are here and I'll do my best to help. So these kind of phrases are going to be part of your course so that you can at least memorize few response and that you can use everywhere. And it is going to change your marking in the exam. Our students usually get 6 to 7 in approach. And we always see that in the exam sheet, that they always get very high mark in the approach because we make sure of that. So that's your one domain. The second domain in here is the history taking. Third domain will be how you are asking physical examination. And fourth domain is diagnostic formulation. So there are 4 domains. In each domain, you will be marked from 0 to 7. For each domain, the passing rate is at least 4 out of 7. So if you get 4 in approach, you pass that particular domain. Okay? So every domain will be marked from 0 to 7, and then combining all of the domains, you'll be given a global score in the station. So that's what we are talking about. So key steps, domains, and an assessment of the overall performance. Overall performance is the global score. If you get 4 out of 7 in the global score, you pass that station. So this is from AMC Clinical Specifications Guideline. Each scenario has a single predominant assessment area. This is a lot of course do not give you that idea that how the candidates are marked in the exam, because this predominant assessment area is the main thing for that particular case. Like, it could be the history, that's the predominant assessment area in that particular case, could be management, could be diagnostic assessment. So for each case, there is one domain which is predominant. Like in this particular domain, we are talking about approach, history, physical exam, diagnosis. One domain, let's say history, definitely for acute shortness of breath, history is the most important thing. Without a proper history, you cannot find out the diagnosis, you cannot manage the patient. So history will be the predominant assessment area. If you don't get pass mark in the predominant assessment area, you cannot pass this station. If you miss most of the key step in that particular case, you cannot pass that station. So when you are doing a case, you need to know which domain is the most important domain and what can be the key step in that particular case. If you can achieve that kind of understanding, you can pass every station. Marking. So we're now going to talk about how the marking works in the exam. So the marking system for the examination contains three components: key steps, domains, and the global score. Each station will have several key steps and domains that are relevant to that station. So when a clinical examiner marks you, they will be looking for these three things: key steps, the predominant assessment area or domains, and the global score. So let's talk about these three things. Typically, in each station, there will be between 2 to 5 key steps that a candidate is expected to demonstrate. These will be marked as observed or not observed. Like if we show you this is a sample mark sheet. And this is what an examiner will have. You might be, like if you have ever appeared clinical exam, you'll see that examiner usually have a tab in their hand, and on the tab, they usually tick these things. So key steps, so they will just tick yes or no, depending on if you have done it or not. Then domains. Typically, there will be 3 to 5 domains for each station. Domains are those things: history, physical exam, those ones. Candidate performance for each domain is rated on a 7-point scale. And domains might include approach to the patient, history taking. In physical examination station, it will be choice and technique of exam and accuracy of examination, differential diagnosis, interpretation of investigations, management, and counseling. So these are all the domains that can possibly come in your exam. And global rating, as an overall performance, examiner will give you this global rating. Remember, the global rating takes into account the predominant assessment area. That's why I always say that predominant assessment area of that particular station is the most important part to pass that particular station. So when you're doing that case, you need to know in your brain, in the 2-minute outside, that this is the one I have to do it right, because that's where I may or may not pass. Let's talk about, so we already have a talk about starting the examination. So in the test center, we already had a bit of a discussion about all of this, so we don't need to go into that. This is how on the monitor exam question will look like. It will be very detailed. You are working in a general practice, so you know that you're in a general practice setting. Your next patient is a 37-year woman who suddenly became short of breath at work yesterday. Task is take a relevant focused history to enable you to further evaluate this problem. So it's the history. You should not take more than 5 minutes for this task. So at 5 minutes, there will be a bell. Ideally, after 5 minutes, you should not continue the history. You should wrap it up. Obtain relevant examination finding from examiner. So you will be asking relevant examination finding. Like for a shortness of breath, your relevant system will be asking about respiratory system and cardiovascular system. An examiner will only give you the results of the findings you specifically request. So if you don't ask about respiratory system, examiner will not give you the respiratory findings. That's what it means. Explain to the patient the probable diagnosis and the possible differential diagnosis, giving your reasons. Everything is important. So you need to read it properly. History from the patient. Examination findings from the examiner. Explain to the patient the diagnosis. Sometimes they can say explain the diagnosis and differential to the examiner. If you don't read the task properly, you'll just do it to the patient. So everything that is here is important. You don't want to miss this. Like let's say you say diagnosis and differential diagnosis. What did you miss? Anyone? You just named the diagnosis. So you said it is pulmonary embolism. You gave differential like pneumothorax, pneumonia. You said it could be heart failure, could be MI. What did you miss?
The reasons for those differential diagnoses.
That's right, Muniba. Very good. So you did not mention the reasons. See that it's just hiding somewhere at the end. And candidates who are not that comprehensive, who do not read the questions, because some candidate, because they are very nervous, they will just read explain the diagnosis and differential diagnosis. In the exam pressure, they will read only what their mind wants to read. Because you know in your head that most of the exam task is diagnosis and differential. Not every task usually asks for giving the reasons. So you did not even read it and you missed that. What will happen that even though you gave proper diagnosis and differential, but you did not give the reason, they will just give you 3 in here. Okay? Having that 3 might affect your pass mark as well sometimes. So when they say that you have to give your reasons, you have to say exactly why you think that this is not your diagnosis. Like let's say you will say that most likely your diagnosis is pulmonary embolism. Because why? Because you have been taking oral contraceptive pill and there is a likely risk factor for having a clot in your legs and that might have traveled to your lungs. It could be due to other causes, such as it could be pneumothorax, which is collection of air in the covering of your lung, which is called pleura, but you do not have any examination findings related to that. Okay? It could be due to pneumonia, which is infection of your chest, but you don't have any fever, you don't have any cough, so it is unlikely. Could be heart attack, but you are young to have a heart attack, and also your chest pain does not go with heart attack symptoms. And also if we have done any investigation, like let's say ECG or chest X-ray, your ECG also does not go with MI. Could be due to anxiety attack or panic attack, but you are not anxious, you are not stressed about anything at the moment, so it is also unlikely. That's what we call giving reasons. So most of the time we say that in exam, if diagnosis and differential is a task, please give the reasons of the differential diagnosis. Say why you think that these are not your differential. And that should be from the history and physical examination that you have done. And that's a very good way of finishing a case by saying why it's not your diagnosis. Okay? Because it shows that you have done, you know what you're doing, you know how to rule out important differential and how to come to a proper diagnosis. And that is really attractive to the examiner because they usually feel that, well, this candidate is a right candidate to pass this station. All right. So let's say this is your task. In this particular task, your key steps. So key steps will be written on the examiner tablet, but you don't know it. You can only think that for a patient who is 37-year-old having acute shortness of breath, what are the most important things? Forget about this. Tell me what you should not miss in a patient who has acute shortness of breath. Because it's not always that these will be the key steps. It could be something else. Definitely, we want to rule out, yes, vitals. Because we need to know whether this patient is vitally stable or not. What do you think? And in the vitals, most important is pulse rate, blood pressure, saturation. Saturation is most important in a patient who is acutely short of breath because it can give us the oxygen saturation and it can give us that idea how bad is the shortness of breath. And that's why you can see in here, they also talked about oxygen saturation. What else could be important here? If it is a case of pulmonary embolism, asking about all the risk factor of pulmonary embolism is a key step. And there are not only travel history, lots of other risk factors are there for pulmonary embolism. Taking a good medication history, like if the patient is on OCP, or if it is a bit elderly patient, is the patient on HRT, or whether the patient had a previous DVT or PE. Is there any family history of coagulation disorder? So all those risk factors are important. Okay? So based on the case, the key steps will change. If this was a case of anxiety attack or panic attack, then your key step would be different. It would be first ruling out all the organic causes, then definitely making sure patient is vitally stable and taking a proper psychiatric history. So finding out the stressor, why she is stressed, that will also come into the key step in that case. So depending on your case, the key step for same case can be different. It can be same history, like shortness of breath, but depending on the diagnosis, the key step will vary. Okay? And then you also get your domains. In here, the domains first is approach to the patient. History taking, you can see that usually they write everything that did you ask the duration of the shortness of breath, any previous episode, chest pain, coughing, fever, recent flu, leg swelling, cough pain, that's for DVT, recent travel history, occupation, medication history. Then physical examination, did you ask about the vitals, oxygen, did you do the cardiovascular exam, did you auscultate the lungs, did you check for DVT in the leg? Diagnosis and differential. So these are the domains. In each domain, you can see the marking from nil is 0 to 7. Let's say a candidate got approach 4, history 3, choice and technique 4, diagnosis differential 5. Will they pass this case or no? What do you think? Guys, what's your idea so far about this? What's the predominant assessment area in this case? The predominant assessment area is history. And in the history, this candidate got 3 points. That means that if you don't pass the predominant assessment area, even though on an average, this candidate can pass, still because they missed the key steps, they also did not get predominant assessment area, they will still fail. But let's say someone got 4 in the approach, predominant 5, and choice and technique of examination, let's say 3, diagnosis differential 4, they can still pass the exam. Because for one particular thing, which is not predominant assessment, they will not fail you. So that is where the things gets interesting in the exam. That sometimes even by doing a lot of mistake, you can still pass that case if you're doing good in the predominant assessment area. Okay? How do we know it? This comes from your understanding, from the logic, from the type of the question, that what can be the predominant assessment area in a particular case. Let's have some example of it. And you'll be telling me that.
Excuse me, can I ask one question?
Yeah, definitely. Go for it.
Y- Yeah. As you mentioned earlier, that shortness of breath question, right? That a 30-year female has shortness of breath, and there could be case of panic attack, and it could be any other organic case, right? So how would one differentiate whether to proceed in one direction, which whether to go with the psychiatric case or to go with the medicine case?
Yeah.
Will there be like the task will be vague, like just 30-year female with shortness of breath, or there will be a detail in the task itself?
Good question. So the thing is that it will be vague, because the patient, when comes to you, they always comes to you exactly like this. They will come to you saying that I have shortness of breath. They will not say that I'm a psychiatric patient. So the exam also will be same. When a patient comes to you with a sudden onset shortness of breath, your task is always to rule out organic causes first. So you rule out the organic causes. So respiratory related, heart related, all the organic causes ruled out, still could not find out what's causing this. Then you think that, well, something is wrong. Then you go to the psychiatric question. So you then you give a confidentiality statement so that patient can feel like talking to you. And then you ask that, could you please tell me if there is anything that you're stressed about? So you go to psychiatric question after you rule out organic causes. And that's how many times exam will give you cases. Like panic attack case can come with shortness of breath. Okay? So you don't know it unless you take a proper history. Now,
One more thing.
yeah,
Sorry to interrupt. One more thing that I want to ask is, like you have mentioned that first to rule out the organic causes, and after that you jump to the psychiatric case. But for example, we have 3 to 4 minutes for the history taking, and if we already took a lot of time in history taking to rule out the organic cause, will it be there like enough time for us to like how to manage the time with the to take the proper psychiatric history in that case?
very, very good question. So the thing is that they know that this is a psychiatric case. They will not give you the task of physical examination from examiner. So they will not ask you for investigation. So the task in that kind of case will become short case. Like they will say history, give diagnosis and differential. That's usually will be the case, so that you have enough time to take a comprehensive history. So exam knows that this case is psychiatric case. So they will give you that proper time. So usually these cases are like that. Okay.
Yeah, thank you, sir.
Thank you. Okay. Now let's say that this is a patient, 24-year-old uni student, presents to the GP clinic due to falling of grades. He has been referred by the university counselor. Take history from the patient, give your diagnosis and differential. In this particular case, what do you think is the predominant assessment area? This is very easy.
History taking.
Yes, definitely, because without history, you can't make a diagnosis. So in a two task, it's really easy to find out that history is usually going to be the predominant. Let's have a look at this one. 30-year-old male presents to your GP clinic with headache for 3 months. He has been recently promoted at work. History for 4 minutes. Physical examination from examiner. Give your diagnosis and differential. What could be your predominant task here?
Yeah, same, the history taking.
Same, history taking, because you need to rely on your history to focus on your physical examination, and then together history and physical exam will give you the diagnosis differential. So you can't really achieve your 2 other tasks without a proper history. So that's become the predominant assessment area. Have a look at this one. 50-year-old male presents to you with chest pain 30 minutes ago. ECG given showing acute myocardial infarction. You are in a rural hospital. The nearest tertiary hospital is 4 hours away. You have no option to transfer this patient. Very common case. You have to take a brief history from the patient. You already know that this is acute MI from the history, from the stem, from the ECG. Explain ECG to the examiner and explain further management with the patient. What is the predominant assessment area in here?
Management should be
Management.
predominant.
Yes, because you already know the history. History is not going to be really important here, but managing an acute MI is the most important thing here. So you understand now, I hope, that how to get that understanding that what is the predominant assessment area in a particular case. It's the most important thing in that particular patient or particular task. Okay? And definitely in a physical examination station, your physical examination, how you do the physical exam, it's the predominant assessment area. All right, I hope that you got a very good idea about how AMC clinical exam works, how the marking system works, what are the assessment areas. So this is just a start of your understanding. I'm sure still it is not making a lot of sense that how to start your preparation, what's all this about, but that will be discussed in detail in our free 2-week sessions. That's going to start from 7th of June. Okay? Now, before we finish today's class, I want to discuss why First Aid AMC Clinical is unique in its preparation and what are the structural changes we are making in this course. This course that we are planning to start from 7th of June is going to reshape the candidate's clinical preparation. We gave a lot of thoughts, a lot of feedback from our past students to find out what we can do to achieve the highest amount of passing rate in clinical exam. And that's what we are going to do in your course. We have never done this kind of a structural change in our clinical course, but in your course, the one that we are starting, that's going to be something that we are really excited about. So let's see what's going to happen. First of all, the course goal is to make sure that you have a proper approach and communication capabilities. We will make sure we always go to updated guideline-based structure. In the course note, you will always find that the notes are taken from RACGP and mostly therapeutic guideline, because these are the most 2 important common guidelines that we follow in Australia. And other guidelines, like for pediatrics, we take from RCH. For your obstetrics or gynae, we use SAHEL. So all the Australian guidelines are there to give you the best possibility to pass the station. Okay? We do not follow any course, we do not follow any notes, but it is specifically written from these guidelines with lots of research. We will focus on your common mistake and how you can improve them. what are the expectations of the examiner from you? Key steps. We will follow the key steps for each case that we discuss, and you'll get a lot of role plays. Our goal is that you success on your first attempt, not on your second or third. Also, as I said, that everything is in one place. The student portal that you will get after enrollment, that has everything there in a very structured way. Even if you don't come to any single live class, the student portal will have everything in place to prepare. So we made sure in that way, so that if in case you can't join the live session, the portal will have all the things that you need to pass the exam. And most importantly, our goal is to make sure that we can give you an affordable learning with the highest success rate. The course structure is, we divide the course into theory classes, role play sessions, and physical examinations. Remember, to pass your clinical exam, physical examination is must. So the course has 1 month physical examination class. Whole 1 month, we will cover each and every cases that can possibly come in your exam. And then we also have face-to-face workshop on these cases as well. Let's talk about our theory class structure. Yes, so there will be role plays included in this free 2-week session as well. So you will also get to know our few other mentors who will be doing the role plays with you. Now, theory class. So as I said, we divided the course into theory, role play, and physical examination. Theory class structures. We are the first course in Australia who has developed the cluster-based approach. And nowadays, a lot of people follow that, but we are the first one who did this cluster-based approach. And this has worked best for years and years. We have found that this has done the best, smartest possible way to pass the exam. So we divide the medicine cluster into different separate clusters. So we take cardiology. So cardiology will be part of your free 2-week sessions. So maybe not all the cardiology classes, but most of it. So we take 5 classes on cardiology, which will cover the common clusters. So syncope or dizziness cluster, hypertension, palpitation, chest pain, ECG, and also after every cluster, we do role play on those clusters. So once we finish cardiology, we will do cardiology cages role play. So all the last 6 to 12 months cages that's under cardiology, we will do role play in the class. Respiratory, 4 class. So we will be covering cough, acute and chronic shortness of breath, post-op respiratory complications. So nowadays, the post-operative respiratory complications are very important, like atelectasis. Even we see a case of post-op delirium. We see cases of post-op hypervolemia, okay, or volume overload. So those cases will be discussed. Hemoptysis cluster, which is a newly added cluster. Spirometry, very, very important for exam. So we'll have each and every aspect of spirometry, and role play. GIT, we will have 3 classes. So covering acute abdomen, dysphagia, which is very important as well, acute chronic diarrhea, PR bleeding, and then role play. Neurology, we have 2 classes covering the most important cluster, headache, blurring of vision, weakness in one side, neuralgia, and neurology role play. Basically, for neurology, headache is the most important cluster. Then we have some random clusters such as tiredness, covering a lot of important cases like diabetic ketoacidosis, hepatitis, herpes zoster. So many cases are there under the tiredness, iron deficiency anemia, okay? Renal cluster, mainly hematuria cluster, musculoskeletal cluster. So this is our new cluster that we are adding in your batch for the first time. Normally, musculoskeletal system we used to discuss in the role play class, but now it has been added in the theory cluster as well. Our counseling cages will cover all the counseling that can possibly appear in the exam. We have seen increasing counseling cages in the exam these days, and these classes will contain all the important counseling that can possibly appear in the exam. Usually you need a structure for counseling, and with a structure, you can do any kind of counseling that can come in exam because there is no limit of counseling cages. Any case can come under counseling. And we also do random cages, which we can't actually put in any kind of cluster. Okay. So these are our medicine cluster, which will have about 18 to 20 classes in total. Now, I want you to understand the difference between us and any other course. One, that they don't cover all these clusters, and even for their medicine cluster, you will be paying more than our full course amount. Is this really needed? Are they better? Are they giving you any extra benefit? No. Nothing is there which we will not be giving you in the course. Is our course has outdated notes? No. Is our course having any less guideline that we can follow? No. Everything that can possibly come under medicine, like let's just talk about medicine, it will be there. And there is nothing extra. Now, definitely there is no limit of cages, limit of disease that can come in exam. But if you can do these clusters, there will be nothing that you can't actually do in your exam. So that's why, because initially it might look like, well, first aid course is really costly because the cost is $9.99. But I see there is a course which cost me only $300 for medicine topic, like medicine cardiology topic, or maybe neurology and GIT. But this is where you're making a mistake because it's not $300 for medicine. It's $300 maybe for only two topic or maybe for only one topic. And you'll be paying more and more dollar for each of the cluster. And at the end of the day, you will be paying a lot to finish your exam preparation. As a beginner, I want you to follow a course which has everything in place and it is still cost effective and affordable so that it doesn't bite you at the end. Next is our pediatrics cluster. Our pediatrics cluster has vomiting cluster, GIT, respiratory cluster, limping cluster, developmental delay and failure to thrive, fever rash cluster. And now we have added in a lot of new cluster which will cover convulsion, neonatal jaundice, crying baby, very important, and infectious disease. We see a lot of travel related infectious disease questions, like we see a lot of hepatitis A in children, in adult. So those will be definitely covered as well. And random cages are always there. And we do pediatric role play of 2 classes. Then we have gynae and obstetric clusters. In gynae and obstetrics, so you can see that even pediatrics, we have 12 to 15 class, whereas many course will give you only 2 class and take 300 to 400 for that, which I just don't get that why. Gynae and obstetric clusters, we have gynae class 1, which will cover amenorrhea. Amenorrhea is very important cluster. Then vaginal discharge, another important. Gynae class 2 will cover parvaginal bleeding, incontinence, prolapse, dysmenorrhea, menorrhagia, STI, which is coming a lot these days, vaginal itching, especially candidiasis. Then also we see the lichen sclerosis case, hormone replacement therapy, vaginal lump, which is basically the Bartholin cyst or abscess. And we do gynae random cages as well with role play. Obstetrics, first class will cover first trimester bleeding, mainly all those like ectopic pregnancy, molar pregnancy, the complete, incomplete miscarriage, threatened miscarriage, those ones. Class 2, second trimester or third trimester bleeding, mainly your placenta previa abruption. Hypertensive disorders in pregnancy. So we have gestational hypertension, we have preeclampsia, eclampsia. Vaginal discharge in pregnancy. That's mainly premature rupture of membrane, preterm labor. Third class, we will focus on postpartum hemorrhage, so primary and secondary, and postpartum complications such as endometritis, mastitis. Pre-pregnancy counseling. There are a lot of pre-pregnancy counseling that is commonly we see in exams, such as we've seen that lithium patient who is on lithium and also sodium valproate, because the patient is a known bipolar patient, needs thinking about being pregnant, so coming for a pre-pregnancy counseling. Known diabetic patient coming for counseling. Gestational diabetes mellitus in pregnancy, counseling. Rubella exposure in pregnancy, counseling. SLE, counseling. So many counseling are there for these obstetrics. Okay, so we'll be covering that in the class 3. And also the infections in pregnancy. We see a lot of herpes zoster related complications in pregnancy, and also like we will find not herpes zoster, by that I mean genital herpes, and also the rubella HIV, those questions. Obstetrics random cages are also part of the class, and then we will do role plays. In your course, normally we do role play classes of only 2 to 3 hours, but in your course we will be focusing on this cluster based role play of even an entire day. So we'll choose a day where each of you who are enrolled will need to come and present and do role play with us for the full day of the cases that is important for gynae and obstetrics, for pediatrics, for cardiology. In that way, it will be kind of a mock exams that we will be doing usually after every clusters. Okay, so that is also a new additions for you. Cluster-based approach. So for psychiatry, we have extensive psychiatry classes. So you will get a psychiatry class in the first class that we will be taking in the free 2-week session will be this MSc history taking. It's a very, very good class, and you will learn a lot about psychiatry from that class. We will also do a psychiatry MSc role play. We also have few other in the course, so anxiety disorder, MMAC, delirium, dementia, substance abuse, and also a lot of random cases. Psychiatry needs a lot of role play, so our plan is in your batch to give you 2 entire day of psychiatry cluster-based role play. And most importantly, physical examination. So we have 1 month. In 1 month, you get 9 3-hour classes covering all the physical examination. Our physical examination is one of the best physical examination course that you can get in anywhere, that we can guarantee you. And you might have seen a lot of feedback from our recently started optional face-to-face workshop that we are doing in different states. So one of our other supervisor does that this face-to-face workshop. So this is not part of the course, but when you are an enrolled student, you get discount to join this face-to-face workshop as well. Now it's not must to do. Even with our 9 comprehensive classes, in your batch we will be showing it with our video open. So you will be having video open, and you will be able to see how we are doing it on the mannequin. Okay, so you really don't need to attend the workshop, but again, there is nothing better than doing it in person. So if you can attend those workshops, that's going to give you a much better confidence for the exam. But if you're in overseas, I can assure you that these 9 comprehensive classes will be enough. Okay. And this is a glimpse of the portal, how it's going to look like. It's just the physical examination part. You can see that our physical examination cover all the important cases. So if you are following the exam pattern, you know the cages, what is important. So we have finished this just recently. It has all the important cages that can possibly appear in any kind of physical examination. Like death confirmation, I see a lot of confusion about this. So all of these are here. Okay. Even we have added like the new one, which was the upper limb compartment syndrome. We have added with the secondary survey, we see there is a lot of primary survey cages, so that has been added. So all of these are there as part of the physical examination preparation. Okay. So that's our theory-based session over the next 5 months course. In the random role play session, so role play sessions are entirely different from our theory classes. What we do in the role play sessions, we try to cover all the important cages for the exam. You get 1 to 2 role play sessions each week. So each week, definitely there is 2 theory sessions, which mainly will be taken by me. And the random role play session, usually 1 to 2. So usually you get 6 to 8 role play session in a month. With that, we're adding extra entire day role play sessions as well. So there will be a lot of role plays, and we normally don't take a lot of students. So we will have like a minimum students, and we will have a lot of chance to do role play so that we can focus on our students better. This random role play will cover all the necessary cages that can possibly important for your exam. Not only that, in the live role play session, we cover the recent important cages. But you also get access to our last 3 years role play sessions covering almost 500 cages. Like you might say that, do I really need to go through your 500 videos? No, you don't need to, but you at least need to go through the last 1 to 2 years cages. So we recommend you to cover at least last 2 years cages, if not at least minimum 1 year cages, which is important for the exam. In the live sessions, when we do the role play classes, the recent year, like 2026 cages will be mainly discussed, and all the cages will be covered. In the running batch, which is just going to finish in few weeks' time, we made sure that each and every important cages from February till now, it's been finished in this batch. I can assure you that there is no course in Australia who does that, because it takes a lot of time and effort to make those cages, to discuss those cages, and also making notes for those cages. But we do that for our students. And that is not something additional fees or anything. As a part of the course, you get this anyway. So as I said, we make your notes, you just practice. That's the goal. Your job will be listen to what we are doing, listen to the class that we are taking, and practice with a study partner. Not only that, you get access to the recording for the whole duration and additional 5 to 10 months after the course based on your subscription. So we don't give you a limited hour to finish a single course or topic. So you get a lot of time to finish anything that you might have missed. You might be sick. You might need a particular class the night before your exam, and you will have the access. That is something so important. People usually realize that when they feel that they don't have anything to look at, they feel detached from the course who they have paid to prepare for their exam. But in the course, we will have like 24/7 communication. So there is a clinical supervisor. So along with me, there is a clinical supervisor. So she is also going to be your main point of contact throughout the course, and you will be able to send messages directly in the Telegram group, and we will answer any kind of queries that you might have. So this Telegram group, we never used to have it before, but from your course, you will get this new clinical supervisor who will also take weekly session with you, focusing on what is lacking in your preparation. So there will be a person who will be there to push you, to push your preparation. So we talk about mini mock exam, so that will be there. If you don't have 5 months time for your preparation, let's say your exam in 2 months or 3 months, when you pay the full amount for the course, we give you the recently finished batch full recordings. Again, never ever a course has given that. We do that because sometimes we feel, because it's a 5 months course, there are students who wants to finish everything within a couple of months. One, that they have a lot of time to finish this, or their exam is very near. For them, we have the last batch full recorded classes there in your portal. And that also doesn't need any extra fee. It's just part of your enrollment. So if you don't have 5 months time to prepare, or you want to finish your preparation ASAP, you can also get access to this last batch recorded class. And last batch recorded class is important because those role play sessions are part of your preparation as well, because those cases are important for you. We will discuss that in your batch as well, but many questions might not be repeated. We will mainly focus on this year. So from May to, let's say, October or November, these cases will be the main focus for your course. But the cases from February to May, those will be the main focus for this batch. So we'll discuss those cases entirely. Although in your batch, we will also cover those cases, but you will have the access to the last batch recordings to finish those cases in your own time as well, if you want. You really don't need to, but you will have access at least. The most exciting addition to this course. So we have recently added this as part of the enrolled course students without any payment or extra additional fee. All our enrolled students in the last 2 years will get exam week whole day role play session for that particular month. So what happens, like if you are going for an exam in September, we will have whole day role play sessions for that month. So for September, we will do all the recent cases role play, just fast track, doing role play as fast as we can, giving you feedback and making sure that some of these cases might even appear in your exam. Definitely we say that you do not memorize recalls because it is not what we want you to do, but you will have an exam-like preparation. And that's going to help a lot to your preparation, and you will feel much more confident when you'll be doing this cases role play and with proper feedback. That's what's our biggest addition to the course. And we are very excited about this because we know that this is going to reshape the clinical preparation and how students are passing the exam. Because what happens in that the day before your exam, or the month of your exam, you feel so tired, you feel so nervous because one, that you can't talk to anyone, there are no one that can help you to give you some kind of feedback. Sometimes candidates feel very overwhelmed, exhausted, nervous. But this is where we will be with them until the day of their exam to make sure that they can go to the exam with full confidence. So this is something that's definitely under preparation at the moment. We're starting it from July. So that's going to be part of the enrolled students. So we'll do whole day role play, so 8 to 10 hours role play, and we'll cover all the important cases fast tracked. Okay. As I already mentioned, that this is another addition, a clinical course supervisor. we'll do a weekly exam-oriented session with detailed feedback. Like this, the clinical supervisor-led exam preparation is, let's say in the 2 hours, our clinical supervisor will come and have a session with you. They will do focused exam-based preparation feedback, meaning that let's say you'll be doing a bit of a role play, and she will give you some feedback to improve those areas where you're lacking. Or she will show you how to, let's say someone having trouble to write a CV. So she will guide you with the CV writing or job hunting, registration pathways. So all those things that you might be struggling during your preparation, the clinical supervisor will be your next point of contact, who is going to help you throughout your course. Okay, so that's going to be a really good addition to the course as well. Extras, we also have CPD certificate. So if you need a CPD certificate, choose the option 3 or 4 in the subscription. If you don't need a CPD certificate, we also give you a course completion certificate, and we also do job advice, including your CV, upper registration, and job hunting. So that will be also an additional part of your course. Okay. We also having this ongoing at the moment. So one-to-one role play session. So although it is not part of the course, you get discounted session with one of our mentor. If you feel like you need one-to-one session to improve some areas, that also you can book in. And also as part of the course enrolled student, you get discount when you book for full mock exam with us or with our PE workshop. Okay, so that's what we want to say to you, that First Aid AMC Clinical course has evolved a lot for this time. So we have been trying to do this for a while, but we haven't got that enough time. But your batch is going to be the first batch who is going to get this recent structural change that we are making for your clinical preparation. And we are very, very excited about it. So I'm sure you will be in good hands. I'm sure you will learn a lot. And if you follow everything, if you are active, you will pass this exam. All right. So
Excuse me.
yes, you can ask questions
Yeah,
now.
I got two questions. One is that if one wants to give exam in November, for example, how much time span does one need to prepare for AMC2 for a realistic viewpoint? And the second question I have is, does it has the same role like of the recalls, like in AMC1 we have this big role of recalls, right? And
Hmm.
does it also impact in AMC2 also like that, like the same way, or like however it does?
Yes, good question. So usually we say 6 to 8 months preparation is ideal for clinical. Clinical preparation should be extensive. You should not hurry this. You should be really confident and having enough time to prepare. So 6 to 8 months is minimum. Then, yes, recall has importance, but not like AMC MCQ. AMC Clinical is not a recall-based exam. It's more about having a proper structure, having a proper knowledge, having a proper way of doing a case. It's more about that. So that's why we always do the theory-based cluster approach, because that gives you the structure of every case. But yes, recall has importance. So you need to know the recalls, or we do the role plays. So the recall based classes are the role play classes. So you'll be having all the recalls done in the course without any additional fees, but your preparation is not solely based on recall. AMC MCQ has a lot of importance on recall. AMC Clinical is less, but still you have to know the cases. You have to know that what are the expectation, what are usual findings. So you will get to know those things in the course.
Yeah, thank you, doctor.
Thank you. Anyone wants to ask any questions? You can unmute yourself. Malik? And you've got some questions in the chat box. So Sian, AMC Clinical has dates in December? No. So we know that right now we're still waiting for the dates for the next exam. I believe I have seen something. Let me show you one thing. So if you go to AMC website, so that's what we can see at the moment, that the next exam. So even last year, I haven't seen any December exam, but this year, it is likely that you might have a December exam because I can see that the next scheduling release will cover the September to December 2026 period. But normally, I know that it's September, October, and November. That's when the exam usually happens. December, it's very unusual to have exam. But it maybe this year they will open it, but no one really knows. Okay? So late June, you might be able to see all the schedulings. Right now, we know that May to August exam is full, and we know that there are exams happening in July, August, and even June. So those dates we know, but we don't know the dates for September and December, September to December. And Sian are live role plays, most current during this batch, recorded in case we are not. Yes, all the live classes that we are going to do, including the live role plays, will be recorded. So if any of you cannot join, those will be part of your course as well. One of the other thing we forgot to mention is there is another additions that's going to happen is our students, when they are going for exam, after their exam, they will also take a session with the enrolled students with their experience in the exam. So they will share what were their experience about the exam, and we'll be able to know more about what's really happening in the exam, what are the expectations. So sometimes it's difficult to assess them without appearing the exam. So our students from your batch, they will be taking these sessions with you. So you will have those additional sessions where some of the students who has appeared in a particular month will come and then they will discuss their experience, which is going to also be really helpful. So Bridget, if you are joining this year, so let's say in June batch, so you will have July, August, September, October, November. So 5 months in your hand. There is no best advice. If you are able to give full time to clinical preparation, then yes, you can appear the end of November exam. So that is still a possibility, but not before that. And I want you to wait because you still have end of June when the exam will be open for this year. By that time, if you feel like you are not overwhelmed, you are doing you can talk without being shy in front of others, then yes, go for exam this year. But if you think that this is not enough for you, then February, March next year will be the best. So best advice, if you're a beginner, you have no idea about clinical preparation, go for February, March. Okay? That will be a good
Hi,
preparation.
Tarek. Sorry, can you hear me? Sorry, I'm trying
Yes,
to.
Malik?
Oh, okay, finally, sorry. It looks like something wrong with my mic previously. I just want to a quick question about CBDs. I have CBD home from RACGB for overseas registration, it's not Australian registration, but I do have the CBD home. So can I use that CBD home to add the CBD gain from this course?
Yes, you can. So we say that let's say if you are a part of a CPD home like RACGP or ACRM, you can add our classes and gain the CPD points. So you don't need to really choose the options 3 or 4 in that case.
Okay, thank you so much, Dada. And also the dates are, Tuesday, Wednesday, and Sunday for the dates, the
Yeah.
course dates. Yes.
Mostly,
Thank you so
yes.
much.
So the fixed date is, so we have Wednesday and Sunday that's fixed, and the role play sessions can differ. Role play session we usually Tuesday or Saturday. That depends. So that's usually how we will do the class. Yeah.
Okay, sure. So I will also have to reserve Saturday just in case. Saturday evening. Okay.
Don't
Gotcha.
reserve anything yet. So once the course start, you will be given a proper schedule, and then you can reserve accordingly.
Thank you so much, Dada. Appreciate it.
Thank you. That's all right. We do not focus on online physical examination, but the course has notes for online physical examination. So if you're going for online physical exam, our course has the notes for online physical examination, but we nowadays, because everyone is going for face-to-face, there is only a very few candidate who has online exam. So normally we will not cover that. But we have an entire, because we took online physical examination just 2 years before during the COVID time, the notes are there in the portal for that. Payment plans, so if you join in the first few weeks of the course, you can avail our installment plan. So you can pay half initially when you join the course, and then after 6 to 8 weeks, you pay the rest of it. And Sakshi, so getting an exam date for clinical is super competitive. Super. So sometimes you might be fully prepared, but you still will not be able to get a date for the exam. And that's very commonly happens. So because usually you normally depends on how many dates are there in that particular month, but you will be competing with thousands of students for, let's say, 50 seats. So it is quite difficult to get an exam date. So normally we say that if your preparation is at least 60 to 70%, then yes, go for book the exam. Okay. And when you are booking the exam, try to book the exam the last month, because then you have more time to prepare. Like when they did the May to August, my advice will be to trying the last few days of August. Okay. That usually is a bit helpful, because we are planning to do the exam week role play sessions. So exam week role play session will be taken in the middle of the month. So if you go for the exam at the end of the month, then it becomes more beneficial for you. Materials will be available. So you have two subscription options. So one subscription option, you can have total 10 months access, or there is also a 15-month access. So you can choose either one of them. Yes, Fatima, every student get access to the past batch recording, but only when you make your full payments. It's not really true. So I can't see your name. So if you're in rural Australia, and you can be eligible for online and offline exam both. The thing is that online, offline, it really doesn't matter. If you can talk really nicely and having a good flow of your accent, having a good flow of conversation, and you can talk without thinking in your head, then online exam is best, because it's mostly about conversation, how you are delivering, those kind of things. So people who used to pass online exam, they were really good with their word. They were really good with English. So if you are someone like that, yes, I would say go for online exam because it's easy preparation. The problem with offline or face-to-face exam is you have to do physical examination on a person, and that can be quite tricky. An online exam just needs talking about what you're going to do. That's the only thing that is different. Everything else is equally same and difficult. Okay? So my advice is it depends on you. If you feel that you are someone who can talk really fast, talk without thinking, your accent is not that bad, then yes, you go for the online. No, exam fee is not refundable. Remember that there is no rescheduling for AMC Clinical. Once you register for the exam, you are done with it. They will not refund you. And if your visa gets rejected, they will not refund you as well.
Dr. Shan, can I ask a question, please?
Yes, definitely.
Sir, I'm a total beginner to this clinical exam. I just recently cleared the AMC. So could you just provide us with the advice of how to start preparing for this, the resources, and what should be the points we should focus on, and how should we have our schedules, etc.?
Okay. Yeah. So Muniba, today we mainly did not focus about how to start the preparation. We mainly gave you an idea about how AMC clinical exam works. As part of the preparation, that will be more and more discussed during our 2-week session. But if you are just waiting at the moment, the best way to start your preparation is to read the handbook of AMC clinical preparation. So just like the old MCQ, clinical also have this handbook where there are 150 pages. Although those are like long ago it was updated, but it has the essence of clinical exam. And a lot of cases come from the handbook case still now. So my recommendation will be to start reading those handbook cases because they have written what are the key steps, what are the common mistakes, what are the critical error. So all those things are written on the feedbacks. So it's a very good way to start your preparation until you start a course because the course will reshape your preparation. It will give you everything that you need to start with. Okay, but until that, my recommendation is you read the AMC Clinical Handbook, get an understanding about how the cages are structured, and then once you start the course, once you join our sessions, it will start making more and more sense. Okay, once you start your preparation, it's also important to divide your days like this. So let's say that you divide your days in the first few months of your preparation. You will be mainly focusing on theory-based learning. So you learn as many theory as you can, like the cluster-based approach, right? So once you have got at least you have finished medicine, you have finished pediatrics, you will have a very good knowledge of the approach. Then you start focusing on doing the recalls as well. So your days will be divided into first half of the day. So if you are giving, let's say 10 or 12 hours, let's say 10 hours for study. Normally I say if you can, minimum 6 to 8 hours should be there. Let's say 8 hours. In the 8 hours, first 6 hours initially will be just learning. So theory-based learning. And then 2 hours, you'll be just doing a bit of a role play of the cages that you have learned. And this timing will change as your preparation changes. So after 2 to 3 months, you will be giving more time to do the role play than the theory because your theory preparation will be almost over by that time. All right. So first 2 to 3 months, focus mainly on learning. Then next 3 to 4 months, it's the delivery phase or role play phase. Okay. But you start doing role play on the first day of your preparation. So the first day you will have our class on the MSc. You will take some deep breath. You will read the theory on that day, and at night you will do role play with your partner. So that's how your preparation will start. And gradually you learn more and more, and you start doing more and more role plays. Okay?
Okay, sir. Thank you so much.
Thank you. Any other questions for you guys? Yes, I wanted to show you this. So this is our AMC clinical group. This is where all the schedules and everything will be shared. So if you go to the featured
Excuse me, Doc.
section of this group, just one second. So if you go to the featured section of this group, you will see the schedule for this 2 weeks free session. So from 7th June to 21st of June, these are all the classes we are going to take. There will be some random role plays as well with other mentors. The class time is same, 7:30 to 9:30. Sometimes it can go to 10. This is the Zoom ID and password. If you want to join the course, then visit our website, which is firstaidamc.com.au. So I'll show you where to register. So if you write firstaidamc.com.au, remember we had a previous website as well, which we don't use anymore. And in that website will be this one. So if you open this was our old website. We no longer use this website. We also give you a notice. Please do not enroll from here. So the one that we want you to go is this one. This one usually comes at first anyway. So if you click this one, this is a very updated and a structured based website that we have created. And the student portal is super, like it has so many structure in there that the students feel that it's really, really easy to cruise, really easy to go through each and every topics that they need. So when you go there, you will see the popular courses. And if you choose the 5 months clinical course and go for check info, this is where all the things that we have discussed, it's all written here. You can also see the course fees. We have 4 different options you can choose from. Then if you want to register, you just click on the register now button, and then they will take you into various steps. Okay. Who wanted to ask the question? Someone wanted to ask you questions?
Yeah, Doc, I missed the time span you mentioned to study. Was it per day you mentioning, like 8 to 9 hours, or per week?
Per day. So 6 to 8 hours
Oh,
minimum.
okay. Thank
Okay.
you.
Initially, it requires a bit of a time, but over time, it
Yeah.
becomes easier.
Okay. Thank you.
Thank you. And Arjun, yes, so you are a GP registrar. You're planning to join the local hospital, RMO. Yes. So definitely, once you are already in the system, and the AMC clinical exam will be very, very easier for you because it is the system that most of the people struggle with. Because you are not working in a country and you are appearing exam to be a doctor in that country. You don't know anything about this Australian health system, how it works, what are the expectations. That's where the gap is. That's where you get fail in the exam. But we all the mentors in First Aid AMC, they are working in Australia, and they are working in here for a long, long time. So we know the system. We're here to help you, and definitely it will not be difficult for you. Okay. So I hope you guys enjoyed the session. I hope we will see you in our free 2-week sessions. And until then, have a good life. Bye. Thank you all.